We might be going back to work, but we have to stay safe. So what's the new norm of testing?
This is a killing weapon.
Things with Covid-19 are changing so quickly right now, and we may be in a situation where we can introduce patients back into clinic very soon. This means we need to be prepared, safe, and talk about PPE. There's a lot of practitioners out there that haven't been testing during the virus. So here's a quick refresher of what's the new norm of testing. Antibacterial gel is going to be the new work essential that we'll all have in our work bag. It's a great idea to disinfect your hands before you enter the practice, just in case you picked up something on your commute to work. Once you have entered the practice and set your room up, you need to thoroughly wash your hands. This is by using the recommended 20-second rule or singing happy birthday twice. Now let's put on our gloves. You may not be used to them, but we do need to be testing with them. Nitrate gloves or surgical gloves are the recommended ones to use. They do fit tight but are comfortable to wear. It is crucial to disinfect all surfaces within the testing room. Now this is nothing new to us, as we've been doing it in our routine tests already, as we are healthcare professionals, but it's just a reminder and to highlight the importance of it. Easy tip: anything yourself or the patient has touched must be wiped down. Everything on the slit lamp table needs to be thoroughly cleaned. Make sure you get the headrest and chin rest, the eyepieces that you'll be looking through, handles and everything surrounding. The autorefractor needs to be thoroughly cleaned, headrest, eyepieces, anything that the patient will touch, even the handles that you will be holding. Even the dials using to control the autorefractor needs to be cleaned. The keyboard and mouse is also essential for this. The main importance of this is you don't know who was in the room last and who's touched this equipment. Just stay safe, clean it all. An important note: all antibacterial wipes recommend air drying for maximum disinfectance. Please have a look at the packaging and instructions to see what they recommend. On average, 60 seconds is recommended for maximum disinfecting. In addition to this, disinfect the pre-test area with the same amount of thoroughness. Anything yourself or the patient will touch needs to be cleaned. This is no different to our normal routine, but again, a gentle reminder. As patients enter your practice, please ask them to disinfect their hands with antibacterial gel. Same importance of not bringing in any germs that they may have encountered through their commute. Masks are going to play such an important role in the new way that we test. They need to be worn at all times whilst in the practice and testing. This is for the safety for yourself and the patient. If you can provide a mask to the patient, you can add that extra layer of safety. It is important to be conscious of your position in the room. It's good to be a healthy distance away from the patient and to one side. When refracting, ideally a phoropter head is better. It gives you a safe distance by using the unit and not having to be in front of the patient as much. We recommend using a slit lamp rather than an ophthalmoscope during these times, as that close distance is just not ideal. With additional safety, you can add a slit lamp guard to protect yourself. One thing you'll realize very quickly is your glasses and the slit lamp will fog up all the time. Here's a quick trick to stop that from happening. Grab a little bit of surgical tape and put it on the top part of the mask. This will stop the hot air from rising and steaming your glasses and slit lamp. I've used this myself and it works brilliantly. Once you have completed your sight test, you must go back into your room and clean and disinfect all surfaces. You must remove your gloves, wash your hands and put on a fresh set. When you are disinfecting the surfaces, please remember the recommended air drying time for maximum disinfecting. I hope you enjoyed this video, and if you have any questions about getting ready for work or PPE, please get in contact with us, we're here to help.